Hi, I'm Samir Parekh. I'm the director of the Multiple Myeloma program at the Icahn School of Medicine at Mount Sinai in New York. And I'm going to speak today about some exciting developments with CAR T for myeloma patients. I had a presentation yesterday on the earlier use of cilta-cel and its correlation with better immune fitness in patients that have gotten cilta-cel as part of the CARTITUDE-4 study. So this was a study that randomized patients to get cilta-cel after 1 to 3 lines of treatments. That is, after they had relapsed two or three times, as compared to earlier studies with cilta-cel, like the CARTITUDE-1 study, where patients had to fail 3 or more lines and were much more proteasome inhibitor or Velcade and Revlimid refractory. These patients only needed to be refractory to Revlimid. And what really came out as exciting in this study was that there was an overall survival advantage as well as a progression-free survival advantage if you treated patients with CAR T earlier. This is not still out there in the community, and patients are getting other standard of care treatments instead of CAR T. So we decided to study the bone marrow samples and the peripheral blood of patients that had gotten these treatments to see if we could actually understand why patients were doing better, and the results were startling. While doing this, an analysis of both studies breaking up the patients by lines of treatment showed that the patients that got 1 or 2 lines of treatment actually had a much better progression-free survival. In fact, if we look at patients that were treated late in CARTITUDE-1, for example, with 3 and more lines of treatment, their progression-free survival was about 35 months. If they had exactly 3 lines of treatment, that jumped to 50 months. And it's not even reached for patients that have gotten less than 3 lines. So 1 to 3 lines is still developing. Strikingly, looking at their bone marrow, we found that the bone marrow environment actually helped the CAR T. So there were cells in the bone marrow called myeloid cells that are anti-tumor, and T cells that we know are anti-tumor that were being activated by the CAR T more in patients in early lines of treatment than in late lines of treatment. And we also measured a very key feature of T cell fitness, which is how many naive T cells. These are young T cells that can fight tumor more effectively. And we found that patients with earlier lines of treatment had more of these. And in fact, that correlated with progression-free survival, that even correlated with 1 or 2 lines of treatment. So it really goes to show that cilta-cel given earlier works better, not just clinically works better, but works better by harnessing our immune system better. And this is something that both patients and doctors really need to understand, because I think there are still patients in the community that don't get offered cilta-cel, and education around this is very important. So I would advise patients to talk to your doctors, talk to CAR T specialists. If you have seen even 1 line of myeloma and your disease is coming back, there are very effective treatment options now, and cilta-cel is proving to be a great one. At least consider it and see if that's an option for you.
If our videos have helped you in any way and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.